Thank you, Abby, for completing that addiction assessment. I really appreciate your responses. During the assessment, you mentioned that you've been using meth pretty regularly, and also you noted that you use cannabis and alcohol. But one thing I'm kind of wondering about is your substance use with your partner. You mentioned that you usually use with your boyfriend. Do you mind if I ask you some questions about your relationship and your drug use with your boyfriend?
Why?
Because it helps me get a better understanding of the patterns that you're involved in, right? And the reasons why you use, and if there's any barriers to stopping or changing your substance use. Oftentimes, when people use with their partners, they get into kind of a dynamic that's useful to understand in the early stages of getting help. Does that make sense?
Okay.
Okay. So, how often would you say that you use with your partner?
Like every day.
Okay. And how long have you been with him for?
I don't know. On and off for a few years now.
Okay. And were you always like just at the beginning of your relationship, were you always using meth and alcohol with them, or did that kind of develop over time?
Um, no, the first time I tried meth was with him. Um, it started pretty much right away.
Okay. So he introduced it to you, right?
Yeah, we used to party together. Um, that's where we met. So,
Okay. And when you say party together, what does that look like? What does that mean?
um, I work at a bar, like I bartend. So like he used to come in all the time. I get off work and like we just stay after. And then I guess he started inviting me over. He does like I don't know, I don't know, like small party, like I don't know, like 10 or 12 of us at at our place. And that's where it started.
Okay. Yeah, it sounds like you live with him as well too, right?
Yeah.
How long have you been staying with him?
Um, I've been staying with him since then, but I gave up my place about a year ago. So,
Okay. Okay. And how would you describe your relationship with Mark?
um, um, I we really love each other. Um, we don't I don't know. We really love each other and it's just a little fucked up.
Okay. Can you tell me a little bit more about that?
Like what?
Well, when you say it's fucked up, can you tell me about like some of the difficult times that you have with him or some of the difficulties you have in your relationship?
Yeah. Um, he Mark's like a really good guy. Um, but we fight a lot. Um, at least we used to. Um, I don't I don't pick fights, but I just get really angry with him. It's hard to like you don't know him, so it's hard to talk about because like he's not a bad guy. He's just like um stressed out and I get it. Like I'm kind of hard to live with and like it's just fucked up because It
I
just
hear,
shouldn't. Yeah.
I hear this is really hard for you to talk about, Abby. I'm wondering, is Mark ever physically abusive towards you?
Yeah.
Okay. When I work with people who are in abusive relationships, I have a questionnaire that I go through that gives me a better idea of like the extent of the abuse, right? And how the kind of level of risk that you might be in. Can we go through that questionnaire together?
Sure.
Okay. So this is called the SARA, and you can see it right here. It's just a checklist questionnaire that I'm going to go through. And if there's any questions you don't want to answer, or if you have any questions for me along the way, just let me know, okay? And just remember our limits to confidentiality, that whatever we discuss is private and confidential. However, if you do mention that you're a risk to harm yourself or other people, or if some of the other limits to confidentiality apply, then of course, I have to respect those limits, okay?
Okay.
Okay. So a lot of these questions are about your partner, Mark, right? So just let me know the best you can. The first question, and really your answers need to be yes, no, or maybe. Okay.
Okay.
Great. So the first one is, has Mark ever been physically abusive or assaulted other family members, not yourself?
No.
Okay. Um, does he have any history of assaulting strangers or acquaintances?
No.
Um, has he ever like been on a conditional release from jail and violated that release or violated community supervision orders?
Maybe.
Um, has there been recent relationship problems in your relationship with him?
Yeah.
Um, does Mark have any relation? Oh, sorry, does Mark have any employment problems?
Maybe.
Um, do you know if he was a victim of or witness to family violence as a child or as a teenager?
Yeah.
Um, and it does he have any recent substance use or abuse or dependence?
Yep.
Has there been any recent suicidal, homicide, or homicidal ideation in the past?
Like by him?
Yeah, like has he told you that he's suicidal or that he wants to kill you or kill someone else?
Yeah, but he doesn't mean it.
Um, has he ever shown any kind of like disconnection from reality or psychotic symptoms? Like has he ever appeared delusional or like look like he's hearing voices or feel looks disconnected from reality?
Yeah, but I don't think he tells me that I did things and I don't think I did.
Okay,
Um, so maybe, I don't know.
okay. Um, and like, has he ever had a psychiatric evaluation before? Um, and do you know if he like has severe problems with like anger, impulsivity, or like unstable behaviors?
I mean, yeah. Yeah.
Um, and it sounds like he has been physically assaulted towards you in the past. Is that right?
Yep.
Okay. Has he been sexually assaulted towards you?
Yep.
Does he get really like sexually jealous or like worry that you're cheating on him? Um, has there been an escalation in the frequency or severity of abuse towards you? Like, is the assault towards you or abuse towards you getting worse?
Yep.
Um, has he ever used weapons against you? Okay. Has he ever credibly threatened your life, like threatened to kill you?
Yeah, but he doesn't mean it.
Um, has he ever had like a no contact order or a restraining order that he's violated?
Mm.
Sorry, could you repeat that answer?
No.
No? Um, does he minimize or deny the abuse that he does towards you?
Oh, he always says he's sorry. He really regrets it. So,
Okay. And does he have an attitude that being abusive towards you is okay, or that an attitude that condones his behavior?
Like when he's himself, no. But when he's doing it, it's just like a totally different person.
Okay. And is there anything else that you think I should know about, the abuse that's happening in your relationship?
Um, I don't want to get him in trouble,
Okay.
so no.
I hear that you don't want to get in trouble. Have you ever thought that he might like end your life or seriously harm you?
I don't know.
The assessment that I was doing is complete, and you identified some very concerning things, right? That it sounds like the abuse towards you is getting worse, and that he has a number of characteristics that people who commit serious violence against their partners or who commit domestic homicide um, typically demonstrate, right? And so, after going through this assessment, it makes me really worried about your safety. You mentioned that you're living with this guy, that you don't think you have any other place to go, that he's supplying you meth, that you're dependent on meth, and in a way, you're kind of dependent on this guy. And to me, that makes me really worried about your safety. What do you think about that?
I mean, I don't know. Like I get what you're saying. Um, I just don't know. I
I
don't know
hear
what to
you.
do.
Yeah, I hear you. Like, do you have any friends or family that are worried about you, um, that have expressed concerns about your relationship?
Yeah, that's why I'm
Yeah.
here.
And is there someone else that you could stay with, or have you thought about like leaving your partner?
The only other person I could stay with is my sister Jenny. Um, she recently cut me off. That's why I'm here. Um, if she thinks it's that bad, um, but no, I don't have anywhere to go.
Okay. And if you cut back or stopped using meth or stopped drinking, do you think your partner would have a problem with that? Or do you think you'd get angry about that?
Um, I mean, when I do, um, he's not angry. He's just not helpful.
Okay. I hear you. And like, I appreciate that you've reached out to our addiction service and I want to help you the best that I can and help you figure out some goals, and help you, essentially live the life that you want to live. However, it'd be really hard for me to help you if, you end up in hospital because your partner harmed you so badly. And I can't help you if you're dead, right? And there's a lot of indicators here that really make me worry about your safety with this partner, right? And so I want to help you develop a safety plan so that you can be safer, that you know what to do if he's becoming abusive towards you, you know what to do if you want to leave this relationship. And you have other services that help people in situations like yours that you can reach out to when you're ready to or if you want to. Can we develop a safety plan together?
Yeah, I don't know. Um, it like if we- if that's true, yeah,
Like I'll be here with you. I'll walk you through this process, and like I said, we develop this together, right? So I'm not going to ask you to do anything you don't want to do. It's all at your own pace. But I really want to thank you for sharing this with me. It takes a lot of courage to talk about what you've been through, and I want to help you get through this. Okay.
okay.
All right. Thanks, Abby.